Navigating the world of health insurance can be tough for anyone, but the coronavirus pandemic making it even more complicated for a lot of Californians.
Seth Denson joining us now. He's an author and health insurance expert to help us sort through the details. Seth, thanks for being with us on the Fox 11 News at 6 o'clock. So the main question right now is, what are the insurance companies doing with COVID-19?
Yeah, so most of the insurance companies have stepped up as they need to and realized that COVID-19, the treatment structure of that is going to be treated like just about anything else that your health insurance plan would cover. It's not going to be denied. If you're admitted to the hospital, it's going to be covered. You may have deductible and co-insurance. Some insurance companies are actually waiving those. But if you actually need to get tested, that's waived for everybody. So no co-insurance, no copay. The test itself is covered at 100%.
But then say you have it, what happens to you once you get it in terms of insurance, in terms of your care? Because that can't be cheap.
Sure, and that's really going to be depending on your plan. Now, again, some health insurers have stepped up and said that we're going to waive the cost of treatment as well as the test, but other insurers have not done that and are saying, hey, your normal co-insurance or copays are going to apply as they would if you got, let's say, cancer or diabetes or any other illness to which you needed to seek care.
All right, so what about the experimental drugs like the malaria drug, hydrochloroquine?
Yeah, well done on pronouncing that. That one's a tough one. So most health insurance plans actually already covered those specific drugs. But rest assured, those drugs that we're talking about, they're relatively inexpensive anyway. So even if you didn't have insurance or your insurance policy didn't cover it, you're looking at a cost of about $15 on average to fill that drug. So the reality is, for most of the people that are going to get that drug, however, they're going to get it in the hospital. So it would be covered under the medical insurance plan. And quite frankly, the federal government right now and the Department of Health are covering all treatments as of today.
So in California, the time window for covered California, which is sort of the state Obamacare, has been extended. There's some conversation about doing that nationally as well. So there is time to still get insurance. But if you don't have insurance right now, what happens to you?
Well, again, right now, I think that our society and our healthcare system is really rallying around getting people treatment. So that's the key. I think this is one of those where there's going to be a lot of sifting through the actual cost of this at the end, but the federal government and the state governments are stepping up. That being said, it is important that everybody have health insurance, and if you've lost your income, the great thing is that Covered California has programs to help subsidize the cost of health insurance. And so since there is a special open enrollment period through June the 30th, if you've lost health insurance because maybe you've lost your job or you never had it to begin with, you can go and enroll now.
Seth Denson, thank you for being with us. By the way, one of the best-looking home studios we've seen.
I love seeing everybody's home, right?
Great
style to you. You got a book called The Cure, A Blueprint for Solving America's Healthcare Crisis. That's out right now.